What if the hardest part of medicine isn't knowing how to save a life, but deciding when, how, and for whom to do it? Today, medical ethics is no longer a quiet side topic for philosophers. It is at the center of real-world decisions happening in hospitals, clinics, labs, and even on our phones. So in this video, we are breaking down the 5 most important questions in medical ethics today, not just what they are, but why they matter, how they work in practice, and where the real dilemmas are found. The first question is triage. Who gets care first when there is not enough to go around? This is not only about emergencies or disasters. It shows up in ICU beds, organ transplants, specialist appointments, and even drug shortages. The core ethical mechanism here is balancing 3 things: urgency, chance of benefit, and fairness. A patient in the most danger may not always be the one most likely to survive, and that creates painful trade-offs. For example, during a shortage of ventilators, should doctors prioritize the sickest patient, the youngest patient, or the one most likely to recover? Different systems answer differently, and that is why these decisions can feel both necessary and deeply uncomfortable. Second, what does it really mean for a patient to agree to treatment? Informed consent sounds simple, but it is really about whether the patient truly understands the risks, benefits, alternatives, and consequences. The mechanism behind this is patient autonomy, the idea that people should make decisions about their own bodies. But autonomy only works if the information is clear, the pressure is low, and the patient has enough time and capacity to decide. A concrete example: if a doctor says, "This surgery has risks," that is not enough. A useful ethical process explains the likely outcomes, the alternatives, and what happens if the patient chooses nothing at all. This matters because consent protects people from being treated like a diagnosis instead of a person. Third, who should control your health data? Today, your medical information can be in hospital records, fitness apps, insurance systems, and research databases. That creates enormous benefits: better diagnosis, earlier detection, more personalized treatment, but also huge risks. The mechanism here is a trade-off between privacy and utility. More data sharing can improve care and research, but it also increases the chance of misuse, discrimination, or data breaches. For instance, a wearable that tracks heart rhythm might catch a serious problem early. But if that same data is sold or exposed, it could be used in ways the patient never expected. Fourth, should we just be fixing disease or also improving humans? Tools like CRISPR make it possible to edit genes, which raises a huge ethical question. Where is the line between treatment and enhancement? The useful part of asking this is not just science fiction. It forces us to think about what medicine is for. Is the goal to restore normal health, reduce suffering, and prevent disease? Or should it also increase traits like intelligence, strength, or appearance? The mechanism here is about unintended consequences and inequality. Even if the technology works, it may only be available to the wealthy, widening existing gaps. And once enhancement starts, people may feel pressured to use it just to keep up. Finally, when, if ever, should medical professionals decide for a patient who refuses treatment? This is one of the hardest questions in ethics, because it pits autonomy against harm prevention. If a patient refuses a life-saving blood transfusion, respect for their choice is at stake. But if someone is confused, suicidal, or unable to understand the consequences, then the ethical calculation changes. The mechanism here is decision-making capacity. Doctors are not asking, "Do we agree with this choice?" They are asking, "Can this person understand, reason, and decide for themselves right now?" That distinction is crucial. These 5 questions: fairness, consent, privacy, enhancement, and autonomy, are not abstract. They shape who gets care, what data is collected, what technologies are developed, and how human dignity is protected. And the reason medical ethics matters so much now is simple. Medicine is becoming more powerful faster than our instincts for fairness can keep up. So the real question is not whether ethics belongs in medicine. It is whether we are willing to make the hard choices well. The 5 most important questions in medical ethics today is just one small part of medical ethics. If you are interested, our full free medical ethics course is linked in the description.